Yes.
Okay.
Wherever you're comfortable.
Okay. Colon cancer is the second leading cause of death among cancer sites. Despite continued progress in general cancer care and treatment, only slight advancements have been made in the treatment of colorectal cancer, end quote. Stefanik from Colon Cancer. Some of you may ask, why colon cancer? And colon cancer is a leading cancer which pushes for more cures, but for another reason is because it also has hit my house for the reason being of my stepdad and him having it. In my speech, I plan to inform you about the screening, stats, management, and treatments for colon cancer. Screening trials using the Gaelic fecal blood test have reduced mortality rates by 16%. National or regional colorectal cancer screening programs and pilot studies have the general population have recently been informed in more than 50 countries, end quote. Joanne Ashoker in Screening for Colon Cancer. This just means that colon cancer has been pushed in more countries and the screening for it has been now more widely known, and the rates of death for colon cancer have dropped by 16%. Now that I've told you a little more about the screening process, I'm going to talk to you about the days leading up to before a colonoscopy. 7 days prior, there are no NSAIDs, blood thinners, or aspirin. 3 days prior, you can have nothing with seeds in it. The day before, you are on a strict clear water diet only. And the day before as well, you have to, at 1 p.m., drink 4 laxatives along with a 64-ounce water mixed with 218 grams of Miralax at 4 p.m. That is to be drinking every 15 minutes at 8 ounces. Now that you have more insight, let's take a look at the stats for colon cancer. I messed that up. For males, you have a 1 in 21% chance of getting it. And for females, you have a 1 in 23%. Quote, in Japan, cancer amounts for 30% of all deaths. Among the numerous factors associated with these deaths, time to initiation has been discussed in the context of adverse effects on survival. Tominatu Monotemi in time to treatment initiation for 6 cancer types, and analyzing data from a nationwide registry in Japan. Wait time for colon cancer is 2 to 3 years, which can be surprising because by this time people can already be terminal, which means that they have little to no chance at coming back and surviving. Colorectal adenomatous polyposis is a common intestinal polyposis and a precancerous lesion associated with colon cancer. Since Crisp described the first one in 1980, APC was discovered with a similar gene aggregation. This quote is from Li Hao Zhu. Now, the statistics may be in your favor for not getting the colon cancer. And now, for the last thing that I'm going to cover is the treatment of colon cancer. Surgical resection is the mainstay or treatment. Systematic chemotherapy and cervical pelvic radiotherapy may important adjuvant treatment. The primary care physician plays a critical role in coordinating increasingly complex multi-modal management studying for patients with colon cancer, end quote. Kalen Brown, Management of Colon Cancer. And the required preparation, patients would have not physically work or visit the anti-patient clinic with prepare from home, end quote. Liam Durzin in improving the care of colon cancer via eHealth. This basically means that people wouldn't have to go into hospitals and perform their colonoscopies. They would later be able to get it from home through endoscopies. But some of the downsides for treatments, such as the surgical reconcision, would be things like internal bleeding, and they can even go on to be as severe as sexual disfiguration. Throughout my speech, I have talked and told you about colon cancer, the screening for it, the statistics, the process of leading up to a colonoscopy, and the management of it. Now that you know a little more about the process, stats of colon cancer, I want you to take a second and think about all the people that in the world right now have been affected by it, and how you are more lucky and just favorable to be here living your life without the struggle and pain of having to go through multiple visits and risks of having colon cancer in your life. Thank you for listening to my speech.